From menopause to GLP-1s. Now, let's talk about this. When it comes to those, are Americans in the midst of a weight loss revolution or a health gamble? Drugs like Ozempic and Wegovy, they're skyrocketing in popularity. Millions use them for shedding pounds and slashing disease risks. But as demand soars, so do new warnings. A shocking new study links these blockbuster drugs to a higher risk of hair loss, especially for women. Now, on the other hand, some researchers say they could be the closest thing to an anti-aging breakthrough we've ever seen. With billions of dollars at stake in this new industry, some big questions remain. One of the big ones is, are GLP-1s the future of medicine or just a short-term fix? We're now joined by Dr. Alexandra Sowa, an expert in physical health and obesity medicine. She's also the author of the new book, The Ozempic Revolution, a doctor's proven plan for success to help you reverse obesity and yo-yo dieting and protect yourself from disease. Doctor, once again, thanks for being here with me.
Thank you for having me back.
So GLP-1 drugs like Ozempic and Wegovy, they've been hailed as game changers. You and I have talked about this before, but it seems like patients are getting conflicting advice. How do we weigh the benefits and the risks?
Well, you have to have a well-informed discussion, and that is actually why I wrote the book, so that people feel really informed when they set out on this journey. There are a few risks, but mostly benefits, and many of the headlines that we kind of feature going into this segment were really kind of a little just clickbaity. I mean, when you really dig down, the inconvenience of things like hair loss really are minimal when people get the big benefits of what these drugs can offer.
Have you seen patients with hair loss? I mean, you have. Okay.
Yes, and it is the exact same thing that happens after pregnancy, and a woman will lose, and I'm still dealing with it after my fourth
girlfriend,
kid.
we can compare and contrast hairlines.
Yes, and so that's actually what happens with this drug too, is that your body undergoes a big change, and we can call it a stressful change. And at the end of it, usually about 6 months in, about 40 pounds down, people will shed their hair. It will regrow. It does not cause permanent hair loss. The phenomenon is called telogen effluvium. The segment before was talking about menopause. There's a big crossover between women on GLP-1s and going through their menopause transition. And in that case, sometimes we might use extra medications to help with hair regrowth.
Okay. Well, congrats on your little one. It's all worth it, but it is funny. Our bodies go through everything. Like, can we just keep the hair? Come on now. Projections show up to 30% of Americans will try these drugs by 2030. What does this mean for the already exploding industry? And will these drugs become even more common nationwide as the years go on?
Yes, they will become more common, especially as costs come down. I think that's the biggest barrier right now, and we really need to get the government on board to help us kind of bring the costs down from the level of pharma and through insurance companies. We will continue to see growth because with every passing month, new studies come out and show added benefits of these medications. They go far beyond just weight loss or just blood sugar management. We're seeing these amazing downstream effects of all this decreased disease.
So if it really is a game changer in long-term, being a long-term solution for overall aging, should everybody be on it? I guess I should ask, even if you are satisfied with your weight.
No, I really don't think so. What we need to move toward is having more of our population metabolically healthy in adulthood. The problem is, and the reason why so many people qualify for these meds, is up to 88% of American adults right now do not meet criteria for full metabolic health. So while we're in this amazing explosion of these medications helping us prevent disease, once we've already gotten to a disease state, we need to focus as a society as to how to keep us healthy from the start. Because if we can just keep that health from the start, then we don't need this medication on board.
Yeah, all great points. I got to end it there, though. Dr. Alexandra Sowa, thank you, as always, for being here. I appreciate your time. Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.